Welcome back to this next session on advocacy for safety and empowerment. On behalf of all the presenters in this session, we would like to acknowledge and pay our respects to the traditional owners, past, present and future, of the land we are meeting on. We would also like to acknowledge any Aboriginal people that are present today. My name is Mirjana Wilson and I'm from the Domestic Violence Crisis Service in the ACT. The two lead researchers for this project are Dr Judy Putt from the University of New England and Dr Robyn Holder from Griffith University. This is a very unique research collaboration between researchers, specialist domestic and family violence practitioners and the women who access our services. And I'd like to warmly invite you to share our experiences, our findings and learnings in what is also quite a unique presentation. Thank you.
Hello everyone, my name's Judy Putt. Thank you for coming to our session. I'd like to also thank Anne-Rose and in particular Heather, Peter and Karen who've helped us in terms of being able to present today, but to also acknowledge the assistance of Anne-Rose to do this project. It has really warmed my old feminist heart to do a project like this. It's been just wonderful, and it's also been wonderful to be at a conference to meet some fellow travellers, shall we say, who I've bumped into over the years. I'd like to introduce my co-presenters. Excuse me. Mirjana and Diane, I should add, who are facilitating this session, have been key to our project, have provided a lot of leadership to their service, but also to us as researchers. Next to Mirjana is Robyn Sirr from the Domestic Violence Crisis Service. Next to her is Jennifer Cook from the Domestic Violence Crisis Service. Then it's Kate Csillag from the Alice Springs Women's Shelter. Next to her is Cath. I feel they should be standing up and dancing or something. And next to her is Cath O'Leary, who is our anchor woman for the research project in Alice Springs. And next to her at the end there is Robyn Holder, who is our intellectual, gives a lot of intellectual grunt to our project. I think there's a more flattering way of saying that, but I hope you know what I mean. So our presentation is called Advocacy and Empowerment, and we've heard a lot about advocacy for change and about the empowerment of women at this conference over the last few days. For us, the key question has been, how do we know that change has happened and how do we know that women have been empowered? And that's what's really guided our research. The other guiding principle for our project has been that asking ourselves at the beginning, but also during the project, is, are we doing something useful? Are we doing something beneficial to those involved, the practitioners, the women, users of the services, and more broadly to the policy and practitioner audiences who we hope will use and benefit the research that we do together. So I'm just going to talk for, well, what would now be about 7 or 8 minutes, and to give you an overview of the project, essentially the background, and then my fellow presenters will get up and talk about the research that they've been involved in. And at the end, Robyn will make some concluding comments, and then we'll invite questions. But we will have to kind of speed through things a bit because we haven't got that much time. A copy of the PowerPoint presentation, a more detailed version of our PowerPoint presentation, will ultimately go up on the Anne-Rose website. So if there's things that you feel that we're not telling you enough about, there will be a more detailed version of this presentation available, and you're also free to contact us at any time. So in terms of background to the actual project, we did a landscapes paper as well, not landscapes, it's a state of knowledge paper, which reviewed the literature. And I would really commend that paper to you. Not many seem to have accessed it and looked at it, and I really think it's a very important, and I pay a lot of credit to Robyn here, engagement with the literature in terms of the feminist debates around what we're trying to achieve over the years in the domestic and family violence sector, but also it also canvasses the debates and critiques from Aboriginal women themselves, both as activists and as scholars. There's also an overview of the evidence, what we have at least as evidence, in terms of what Aboriginal women have said and what Australian service providers have said. However, and this is a refrain that you've heard a lot in the last few days, there is a lack of evidence about the impact of domestic and family violence services. And in particular, there's a lack of outcome evidence. So what do women want and value from services, and what tools and practices would elicit feedback from women, users and clients? So this is the 4 research questions that are guiding our project. What are effective approaches to working with Aboriginal women? What are Aboriginal women's perspectives on and priorities for services? How can Aboriginal women's views be more integrated into service practice and delivery? And what are useful methods and resources for services? Our 3 wonderful partner services, women's specialist services, who are working with us on this project are mentioned in the slide there: the Alice Springs Women's Shelter, the Ngaanyatjarra, Pitjantjatjara, Yankunytjatjara Women's Council Domestic and Family Violence Service that operates in Central Australia, and the Domestic Violence Crisis Service in the Australian Capital Territory. So the 2 key elements of our approach is partnership with those services, and secondly is engagement of Aboriginal women in all facets of our project. And this slide here essentially just gives in dot point form the way that Aboriginal women have been involved in this project, as board members, as staff, as researchers, as participants, because they have been clients or users or former clients of the services, and who may be stakeholders in what the services provide. Our methods are participatory and iterative methods, and this slide summarises what we've been doing. And in particular, I would draw your attention to where we're getting our primary evidence from. It includes interviews with clients, former clients, with staff, with stakeholders. We're auditing, trying to review case files to see what kind of information that may usefully produce. And to some extent, we've been doing observation of services, though that's very hard, for example, with a 24-hour crisis line, which is what the Domestic Violence Crisis Service operates. This is a slide summarises up the participants to date. Like a lot of the projects you've been hearing about in the last few days, we're not finished. We're getting near the end. We've got about another month or so to complete what I would call our primary research. But to date, there have been more than 130 women participating in this project, and that's unique individuals. And many of those women we've talked to on more than one occasion. So that's just the number of individuals. Now, more than half of them are Aboriginal women. But what I would emphasise here is that of the women that have participated who have been users or former users of services, nearly more than 3/4 of them have been Aboriginal women. While it comes to staff participants in this research, a much smaller proportion are Aboriginal women, and I think that reflects the kind of service composition of staff across Australia. There's no data on that I've been able to find, but that would be our guess. I did mean to mention the fact that we do know Aboriginal women are using services across Australia, but again, we have no national picture of that. The recent release of that Australian Institute of Health and Welfare report on specialist homelessness services indicated that Aboriginal people were accessing specialist homelessness services at a very high rate. And about 1/4 of them, the 1 in 5 that are accessing specialist homeless services who are Aboriginal people, 1/4 of them doing it for reasons of domestic and family violence. So my back of envelope estimate would be that about 80 Aboriginal women a day are accessing refuges or shelters in this country. So it is a very high number of users. So in terms of to use the jargon, the outputs, what we hope to achieve from this project, the bottom line of this slide shows you that the project has a number of interwoven elements to it that will produce what we hope will be really practical grassroots information about lessons that our three partner services have been able to convey to us, to communicate to us through this project. The combined experience of our three partner services is more than 80 years. And we think they've learnt a lot over the years in terms of how they work with Aboriginal women, and we really want to capture that. We will have Aboriginal women's views on service provision. We hope to generate tools that elicit women's feedback that services can use in an ongoing way, and also tools that will assist services to have ways of getting more general evaluative material that they value, but also, of course, funders value, and also resources on the practice areas that we have identified as key practice areas for services in this sector. So we held 2 workshops with our partner services, and really I just wanted to say that they were very important to set essentially the research focus, which with our 3 partner services we identified the common elements across the 3 services, but also what they wanted to do in terms of the focus of the research that they were going to be engaged in. And there was agreement across the 3 services that the area they wanted to focus on was crisis support and how to generate evidence of short-term outcomes from that crisis support. And so each service went away and developed its own research plan, and now my co-presenters will tell you about what they've been doing.
Hi, I'm Jennifer Cook, one of the crisis workers at the Domestic Violence Crisis Service in the ACT. DVCS is a frontline community organisation that operates within a feminist framework that emphasises human rights and social justice and gives priority to personal safety. DVCS receives approximately 60 incoming contacts on our 24-hour crisis line each day, and we conduct around 4 face-to-face crisis visits each day. 4.5% of DVCS clients identify as Aboriginal women, and over the past 12 months, a further 17 Aboriginal women became registered DVCS clients. It's been our pleasure to be involved in these research activities, and just for a few minutes, we'd like to share with you some of what we've learned from the women who participated in focus groups. The research had 3 components. We set out to seek the views and perspectives of Aboriginal women around the issue of trust in services such as DVCS during times of crisis. We conducted research into women's engagement with court processes and what influences their choices during this time. And finally, we sought the views of women on what they value most during times of crisis.
Okay, and so I'll just outline a little bit about our actual methods for the research that Jen just spoke about. So the research methods for about how Aboriginal women experience trust in services, that's been primarily done via focus group through an Aboriginal NGO and Tracy, a Koori researcher, and interviews with Aboriginal women. Our court advocacy program, one of our workers is conducting interviews and file reviews as a way of better understanding what factors influence how women engage with court processes. And thirdly, the research that Jen and I particularly want to speak about for a few minutes now is about what is it that women value at times of domestic and family crisis. And the way that we've done that is primarily via conducting focus groups, and we've done 5 different focus groups, 3 with mixed groups of Aboriginal and non-Aboriginal women in the community, and 2 conducted with women in the prison in the ACT. And the way that we did that was we didn't want to go in with preconceived words and categories. We wanted to really hear what it is that women named as valuable. And so we used photo images as a beginning point so that women could pick from a range of photos to help them identify what is it that they were experiencing before contacting a service and what is it that they're experiencing after the contact with the service, and that together with us we could help try and find some words around what is it that they most valued in that middle bit. And so that's what we'll talk a little bit about. So these first lot of slides we're about to show you are some examples that commonly came up to illustrate women's experience before they make contact with our service.
This image was chosen by a number of women to depict how they felt when they were in crisis prior to making contact with a service like ours. They used words like trapped and scared, alone, isolated, depressed, a mess, indecisive, shredded.
And then examples of the images they picked for how they felt after the contact.
Yes, this image articulates their sense post-crisis, saying that they no longer felt alone. They felt reassured, much safer. And many women chose this image to describe their sense that they had a renewed hope for the future. So to summarise, the women who participated in these research focus groups told us that they value the opportunity to discuss their experiences of family violence, their fears, their anger, their ambivalence, their concerns for their children, and the support needs of their partners in a respectful place where confidentiality and the right to remain anonymous if they wish are respected. These women also expressed that they valued face-to-face support at times of crisis and court support and advocacy from empathic workers with a strong knowledge of court processes.
So in terms of outcomes so far from this research with the focus groups, where we've got to is we've developed potential questions, 3 feedback questions that we then also brought back to the women to check in that we were hearing what was most important for them and how these would be. So the 3 questions were examples of such as a result of contacting us, are you more aware of options? When you were talking with us, did you feel listened to? And did you feel not judged? And women gave us some extra feedback about that, about the importance of, the language that was used and how the timing of when those questions were asked. We also developed and again test drove with the women the potential use of some scaling questions about the feelings that they identified as common experiential states, and we got their feedback about those use of scales. And again, there were pros and cons about the use of scales, and we'll do more work about that. And I suppose the third sort of particularly unexpected outcome was that the focus group itself, we realised they gave a lot of value to. And so I suppose the next slide is a bit about our reflections, that the experience of doing the focus group with the women in the way that we stepped into it and they stepped into it was a very powerful process for all of us concerned, and they got a lot out of hearing each other and getting their own knowledge recognised and feeling that they were contributing to future wellbeing for other women was a very valuable process. So we also gained learnings about how to do that process better, and they helped us with that. And we felt that is a model that is easily replicated that we might use further in our service. So I suppose that was, the outcomes for us, potential feedback tools. It was also a way of increasing awareness among women about DVCS services, and they spoke of how important that was. But really the 3-way gain for researchers to hear directly from women about their experience, for us to hear freshly with women at a time that they could really give us that. And certainly for the women who took part, one of the women who left said it was better for her than counselling. She really felt that she went away feeling much more positive about herself and her identity as a result. Thank you.
Hello, my name is Csillag and I'm from the Alice Springs Women's Shelter. Okay. This picture was created as part of a narrative therapy quilting project that the Women's Shelter ran a couple of years ago. You'll find the quilts and a lot of other resources created by Aboriginal women from Central Australia experiencing domestic violence at a Women's Shelter website. I encourage you to jot it down, 100voices.com.au. It's a magnificent resource. So I've chosen to begin the presentation with this image because to me it represents what the Women's Shelter is about. Women sitting together, caring and supporting each other. Okay, so the Women's Shelter was established in 1975 by the Women's Electoral Lobby. It was incorporated under the NT Associations Act. It has a board of governance and it has about 40 staff. Services include a 30-bed crisis accommodation service, court support, outreach services and counselling. It is a core member of Alice Springs Family Safety Framework and it also works in partnership with other services to deliver a men's behaviour change program. Recently, it has begun an outreach service to 4 remote Aboriginal communities in Central Australia. In 2014-15, services were provided to over 1,500 women and children from 85 different communities across 4 states and territories. Approximately 80% of our clients are Indigenous. So the research that we've been doing has been conducted with the women who access the crisis accommodation service. In 2014-15, that service supported about 1,000 clients. 97% of those clients were Indigenous and 34% of those clients were under 9 years old. So the research questions we've been looking to answer are: what would demonstrate effectiveness of the crisis accommodation service from a client's perspective? And how can we measure that in an ongoing way? Oh, sorry. There's the research questions. Okay, so this slide. This slide articulates what the Alice Springs Women's Shelter means, or the Crisis Accommodation Service, the shelter, means to women who access it from the perspective of one of the Aboriginal mentors who works at the Women's Shelter. As that mentor, Raylene Ferguson, as she states, when women go into the shelter, they go in all broken, hurt, shamed and lost because they can't believe that their husbands treat them like no good dogs. We tell them to go away to the shelter and get strong again. You can fix your soul, heart and spirit up. Then you can come home to walk your life again with your children and family. So the first step in our research process was to conduct interviews with the women at the Crisis Accommodation Service to determine what they valued about the service and to elicit the language they were using in relation to the service. So from these interviews, 2 main themes emerged, and they were that the women valued, firstly, having their basic needs met. As one woman told me in an interview, she states, "The shelter is good. You can come here and you can get a hot shower, have a sleep, washing clothes, watching TV." Another woman that I interviewed stated, "I feel happy to come here. Staff ask me my name. I get cold kitchen, cold bedroom, I eat, watching movies and cup of tea, happy and comfortable, talking story with other women." The second theme that emerged was of the Alice Springs Women's Shelter as being a place of rest and respite. As one woman stated, it's like a backpack of worries that you can throw away because of the supports here. This is a safe place and you can have a chat and be happy. So, that's our shelter. You'll notice they're a very large fence. We did have to build this fence because after some attempted break-ins and one break-in that was successful. But we've got our lovely big fence. We were worried that the fence, it does actually, it's the same colour and it does resemble the old prison that used to be in Alice Springs, but we chatted with the women and they said that they really like this fence because it makes them feel very safe and secure. We're really happy to hear that. Okay, so having determined what the women valued about the Alice Springs Women's Shelter, we set about creating a measurement tool. We asked ourselves, how do we measure these aspects in an ongoing way that is meaningful and relatively easy to implement in a cross-cultural environment when women are experiencing crisis? This is a big ask. What I've been doing with the help of Cath and the research team is to incorporate the concepts and language gained from the women to develop scales to measure the effectiveness of the service. The women have been reluctant to engage with the paperwork, more white paper, and we're currently trialling a scale drawn in sand, and so far this has been much more engaging. We're still working on refining the tools. We haven't finished yet. We've had some insights into what may or may not work, but most importantly, we've gained some really valuable insights into what the women say they value about our crisis accommodation service. Thank you.
Hello, my name's Cath and I'm presenting today on behalf of the Ngaanyatjarra, Pitjantjatjara, Yankunytjatjara Women's Council, sometimes referred to as NPY or the Women's Council. Unfortunately, no one from NPY could be here today, so they have allowed me to present on their behalf, so we're grateful for that. So just to give you a bit of an overview, the NPY Women's Council was established in 1980, largely in response to the South Australian Pitjantjatjara land rights struggle in the late 1970s, when women were dissatisfied that they had not been properly included or represented in the land negotiations. The Women's Council covers an area of about 350,000 square kilometres in the tri-state region of the Northern Territory, South Australia and WA, as you can see on the slide there. This area includes 26 remote Aboriginal communities and smaller homelands, and it's estimated that approximately 6,000 people live in the area. While the Women's Council began as an advocacy organisation, it has evolved to become a major provider of human services in the region, working to address the needs that clinical health services cannot and that government agencies do not directly provide in the area. In the early 1990s, women became increasingly concerned during council executive meetings about violence against women, the poor response from the criminal justice system, and the low sentences offenders were receiving. The Women's Council's Domestic Violence Service was established in 1994. So the research questions that NPY has decided to look at is what is proper help for NPY women experiencing family and domestic violence, and how can the service measure that? Secondly, what makes a good worker? And thirdly, how do we know that women feel they are believed and more connected from the services that we provide? So to date, there have been three main stages to the methodology. The first was a workshop with senior women. Untitled, referred to as UK for short, Untitled means to think and understand clearly. It's a special project of the Women's Council. They are a group of senior Anangu and Yanangu women who initially came together to work on mental health literacy, but are now working as a research group within the organisation. As a first step to the research, the group was asked to develop shared understandings and language about experiences, feelings, and emotional responses to domestic and family violence. All the workshop participants had directly and indirectly experienced and/or witnessed domestic and family violence. As one of the women explained, their purpose was getting the words clear, as we do in Urikulinjaku. 15 women participated in the full-day workshop, facilitated by 2 interpreters, 2 ANROS researchers, supported by 2 UK project staff, the UK project evaluator, and the Women's Council's deputy coordinator. The workshop helped to develop shared understandings and definitions about proper help and what makes a good worker. Secondly, interviews were held with individual women who have been clients in the past 12 months and in most cases were actively seeking help at the time of the interview. And thirdly, there have been case studies of current case management. So Jane Lloyd has been the lead researcher in this project, and she was involved in 2 active cases assisting and supporting the clients to secure criminal justice outcomes. One case involved the Magistrates' Court and the other case involved a district court matter. During the case management, the women commented about the help they were receiving and how it made them feel. So this was unsolicited information or feedback. So if we look first at the workshop, the UK workshop began to define the kind of help women wanted and needed. The women explored in Pitjantjatjara and Ngaanyatjarra words and phrases for feelings and experiences related to domestic violence. 40 words and phrases in addition to scenarios in Pitjantjatjara and Ngaanyatjarra were then translated into English. So you might be able to see a few of the concepts there. They wanted a staff member, for example, who was authoritative, who was caring, who has a humble way. I'm now going to provide some quotes from the interviews and casework that Jane has gathered in her work. One interviewee said, "A good worker explains the court and justice process and keeps us up to date, so you can make your own plans, your safety, like staying close to the police. Then you can tell the police if he keeps ringing you." Another said, invoking outside help, "We want the worker to stay in front, not behind us and not on the side. We want them in front of us to protect us. We want the worker between us and the police. We worry about being implicated as a witness and all the trouble that can bring us." Another said, "We want a worker who is rapanyarapai, a confident worker." This is also a reference to workers who can be invoked as an authorising outsider. Especially in the context of reporting to police and engaging with the criminal justice system and wanting to avoid further blame and violence, not only from the woman's husband, but from their families. As the interviewee said, "We don't want to be implicated as a witness." The case studies in the court settings demonstrated how important it was for the woman to know that the worker believed and trusted in her. So one woman said, "A good worker gives you encouragement. She trusts you and makes you feel safe. She takes the worry from you so you can relax and tell your story. Let it out." "I was worried I would get my story wrong, but then it all came out. It was like I was watching myself on TV. You were there, you made me feel safe. My sisters said to thank you. They said I would be all right with you." This trust, confidence and encouragement led to the women in both case studies re-establishing social links and sharing their experience with other women. Thank you.
So you've heard, had little tastes really, of detailed interactions over time between people who are ordinarily workers and the women they work with and who work with them. These are by no means the first interactions any of these services have had with Aboriginal women. These are, as Judy said, a combination of 90 years' worth of work in their different localities. But in summing up, I want to take you back to the beginning. Many of you will have struggled with outcome and impact measures in your service delivery. There's a lot of frustration with client feedback, consultations, the dreaded satisfaction surveys. Our literature review identified a number of issues, but two key ones have guided us. One is how pervasive is the problem of measuring outcome and impact, meaning how piss poor is any evidence about work with women as victims, whether Aboriginal or non-Aboriginal, and the services they use and access. Secondly, how strong and consistent is the message from Aboriginal scholars and advocates about recentering different ways of seeing and doing. Our challenge was this, combining these two learnings. This part of the research is having a go at learning, building ways of knowing from the ground up, from women who use the services, Aboriginal and non-Aboriginal women. Participatory methodology is a way of doing work with the complexity that you know exists on the ground in practice. The activities that you've heard are self-conscious, deliberate series of efforts to build ways of knowing, ways of doing, from and with the end user, the consumer, the clients, Aboriginal women and non-Aboriginal women. As researchers, all of us, we're in collaboration with the partner services, they're in collaboration with the women they work with, the women working are in collaboration with the services, and back. This is the big, iterative, fluid process that we're involved with. We wanted to show you what this looks like through these stories, the messiness of participatory process, the groping forward, the necessity of humility, of not being expert. This is collaborative knowledge building from the front line. And there are five things that across these three services, in three different locations that we shared. Finding out, asking, what's important, what's valued by Aboriginal and non-Aboriginal women. Checking out that we understand right. Figuring out how to simplify what we're hearing. Figuring out how to scale up and across from individual conversations and small group conversations, across whole services. Having a go, making mistakes, and checking it out again. So as Cath said, the words, the approach that the community-based workers, researchers use in the lands in Central Australia is to think and understand clearly. Getting the words clear. We're doing this together. Thank you.
Thank you all. I'm looking at our time clock here and there's probably about 2 minutes, so I apologise for that. It was a bit of a challenge to get all of us to present to you, but we wanted to have, I guess, this very unique way of showing the work that we've been doing. So there's probably time for one, possibly two questions if we can. Otherwise, I would really invite you to approach any of the researchers or partner services when you get a chance in the lunch break. Is there anyone that has a question that they would like?
Thank you very much. This is to all the panel. Do you know whether you've had any women coming in from the outstations to access your services, or have you had anybody from your organisations speaking to them to see whether there were any differences between the safety aspect in the outstations as opposed to the communities.
Kate, would you like to answer that one?
Okay. We're very aware that outstations can be very unsafe places for women with no phone reception. Police can be very far away. They could be half an hour away, they could be an hour away, they could be longer. Outstations features very heavily in any safety planning that we do with women around understanding her risks, and also for forcible abduction to a outstation, and then her being very concerned and afraid that no one will ever find her. So we take that very seriously, outstations and its role in her safety plan, definitely.
Thank you.
Sorry. My question is, you've stated that you've garnered trust with the Aboriginal women. If that's the case, why aren't there any Aboriginal women with you here? And secondly, what have you organised to be able to work with men, being able to work with my countrymen in being able to heal this process, considering that our Aboriginal feminism is quite different to yours? And it seems to me, in my view, that this is just a white feminist control and power over my countrywomen. So can you...
Thank you. Judy, would you like to answer that?
Is this on? Hello? In terms of your first comment, Andrea Mason, who is, as you might know, an Indigenous woman in Central Australia, who's the CEO for the Ngaanyatjarra, Pitjantjatjara, Yankunytjatjara Women's Council, would have liked to have attended but couldn't for reasons to do with council business. Tracy Wetnell, who I'd like to acknowledge as the Koori researcher who's been doing amazing work in Canberra, couldn't attend either, though she would have loved to have. We have had good collaborative relationships with the women that we've been working with as co-researchers. I think the question, though, would be better directed in a way to them, to ask them about what they feel about the project. So we would have liked to have had our Aboriginal women colleagues with us here today, but for various reasons that wasn't possible. In terms of the second question you raised about Aboriginal women and their own feminism and how that may differ to someone like my own and the sort of feminist values I may hold, contestation, discussion is very important, and part of what we're doing is seeking ways of collaborating between women, whether Aboriginal and non-Aboriginal women as workers and as users of services and as service providers. But maybe Robyn would like to comment further.
I mean, I don't think, certainly as researchers, we didn't go out to say this is good practice and these services are trusted. What we were setting out to do is to find ways and to find out with Aboriginal women, the users of the services, what it is to trust a service. So we're not saying yes, there is trust, but what it is from their perspective to trust a service, such that they might then use it.
Thank you. I'm very conscious of the time, and I'm sure that there's some other things that people would like to ask and share. So please, I invite you to take that opportunity over the lunch break. Otherwise, can I please get you to once again thank the presenters.